I had a whole other plan for a Medical Monday, but as they say, life is what happens while you're making plans. So instead I'm going to make this a very this just happened type of video. So I'm a little mixed up on the days because of when all this happened, but basically last night, just before midnight, I started having this really sharp stabbing pain, upper right quadrant, or basically your right upper side pain. And then for those of you who don't remember or are just stopping by, I have diagnosed autoimmune hepatitis, not viral, not contagious, not associated with anything. It's autoimmune hepatitis and cirrhosis and a whole other bunch of stuff that we don't have to talk about today. I started having a very sharp stabbing pain, and this went on for a good 20 minutes, and then spoke to someone to kind of evaluate things, and it was decided that the ER is definitely where I needed to be. So I went to the major downtown hospital nearest to me. It's the largest hospital network here, and if any of you have seen Adventures in Babysitting, hey baby, then you remember the scene of the, you know, upper middle class white folks that go down to the city and get the crap scared out of them because they've all been told about how scary the city is. Yeah, it was like that. That ER was horrible. It was so bad. People were around us like being released from prison, waiting to see a doctor, and calling people on other patients' phones asking for cigarettes or food, or it was just so weird. It was so surreal. And then they were like, we've been there about a little over 2 hours. And we're like, can we get any update on when we're going to be seen? And he's like, well, you're almost to the halfway point. Most waits are about 5 hours. 5 hours. So I was like, no. So took this off, throw it away now. And then we went to hospital number 2. Next leading hospital with usually much better staff, providers, clinical staff, and everyone in the I'm in the front and checking you in, or I'm a nurse assisting the doctor, those people were all nice, all of them. And even though I still had a really long wait, there's something about having been moved into a room where you're, you know, hooked up to stuff, makes you have this placebo effect, like, see, I didn't have to wait long at all. But if you really pay attention to the fact that we got there at 3:15 and my discharge was 11:30, and all I really got out of that was a couple of rounds of IV pain medicine, and then of course there was a shift change. So the people that already knew my case and were treating my pain and issues like that, getting a CT scan ordered because I have an elevated D-dimer. That's Googleable. Googleable. You should Google that. Crap, I hate it when this happens. Anyway, they ordered a CAT scan, and they did some lab work, and then the shift change occurred, and the new nurse was also nice, a little new, so, you know, but very nice. And then the new, you know, the covering physician, when my original person left, this new guy shows up, and not trying to exaggerate, I think that he might have had to go and look up autoimmune hepatitis, because I could have told him that I had, you know, anything, and it would just been like the Peanuts thing. I have wah 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 wah. He did not listen to me. He did not examine me. He did not listen for my breath sounds. He did not palpate my abdomen. He did not do basic entry-level assessment of a patient in the ER complaining of pain with a systolic blood pressure going up to 165 over a diastolic that didn't go above 80. So there's a couple of concerns with that, because there is I have medicines that affect my blood pressure. I have by diseases that affect my blood pressure. And then there's also a type of hypertension that is isolated systolic hypertension, where the top number under, 120 over 80, the 120 would be the systolic, 80 would be the diastolic. And my diastolic always has been running low. I usually have hypotension, but since my last medicine update, it has not been as easy to do that. So that's a concern all by itself. I still have to see a cardiologist. In the meantime, the doctor, I always feel like a drug seeker because I have severe pain. When I have severe pain enough that I'm actually going to the ER, that means I need the real pain medicine, because I don't carry a script for a narcotic. I have a lesser pain management, and it doesn't really manage my pain because I have issues with my liver being able to metabolize medication because it is damaged. It has cirrhosis. So it was really disheartening. He just already made up his mind. He didn't even want me to have another round of IV pain medicine. He wanted me to have just an NSAID, which just speaks again to the lack of information this doctor has about autoimmune hepatitis, because you can't really take anything that's going to directly affect your liver, because it's already having to play catch up. It's already, its head is bobbing up in the water going, I'm going to drown soon. And he ended up giving me something that was more like idiopathic, we don't know where it's from pain. And there was nothing I could say to convince him that he had no idea what I was trying to tell him. He just would not listen to me, and just argued with me about, what he thinks is best after not examining me or knowing anything about me, just deciding on his own that he is a super conservative provider when it comes to pain management and pain relief, to the point where he honestly acted like he didn't believe I needed anything. Meanwhile, I keep gaining like a pound a day from the water retention building up because of my cirrhosis. I have calves that look like tree trunks, and I have waist and hip measurements that, I have pants that I wore at my heaviest weight, and they were not as tight on me then as now, when I am a good 40 pounds away, 40 to 50 pounds away from being at that top weight again. And I already have trouble because my shirts are all too big. Sorry if it's gross, but everything on the top is too big. And meanwhile, all my stuff that I was able to wear on the bottom are all getting tight and leaving, making marks in my skin and generally making things uncomfortable. So I am really frustrated. I haven't gone to bed since before we came home. I hadn't gone to bed since Saturday night, because last night I did not sleep at all. I was going to go to the bathroom, and then that's where it all started, and then I was at the ER, so not a lot of sleep for me. So I'm going to see a new primary care doctor tomorrow that is a functional medicine primary care doctor, and I have a giant list here, 1, 2, and then 3 pages that are typed up like as small as like a crib sheet. I had a statistics class in college that, you either hate it or you love it, statistics, and I like math, but some of the things in that class were pretty challenging, and my professor had an allowance for a crib sheet, 1 8.5 by 11 piece of paper with no rules on margin or font size, as well as access to prior year's final exams, so that you could put everything you need to have in there to get a great grade on that test. And that's exactly what I did. And now I have a crib sheet for all of my symptoms, all of what I've been dealing with, because every time I see a doctor that's new, I have to go through this all over again. And let's say that this is 100% of the information they need. On average, people pay attention to this about 30% of the time. maybe less if I actually don't give people credit for just trying to be interested. Usually, like I saw another GI hepatologist type doctor, and had something similar printed up, and he just kind of tossed it aside to that little counter that has the sink there, and it was still there after he walked out. I don't know what the problem is with healthcare. I don't know what vibe I send out, that they just don't want to help me. I mean, I'm not the only fat person in the world. I'm not the only person with hair loss that has a shaved head in the world. I'm not special in this way. I mean, I have a rarer condition that apparently no one got schooling on, but I don't know. It just, as many people as I have seen, as many labs as I have had done, as many things as I have tried to do from one doctor to the next suggesting this or that, I feel like I'm nowhere, you know? I feel like I'm still running on this hamster wheel, treading water, put in your metaphor as you will. And it was so frustrating. It's so frustrating. And I really did add a whole other thing planned for today. So the other thing that I will mention, because it's one of the only things I wanted to really make sure I mentioned on the Medical Monday video, which is that I filed at the end of last year for disability, Social Security disability, and I've gotten through do you have enough credits? Yes. Do you have a disease that is going to progressively get worse or result in death? Yes. My autoimmune hepatitis, my cirrhosis especially, cirrhosis is a fatal condition, okay? There's no other way to say that. Once you have cirrhosis, depending on the level of necrosis, if you have more cirrhosis than not, then you also have very little chance of regenerating those tissues, because once they get to that point, you know, it's like, for people who have no idea what I'm talking about, especially if you're a female, this will be a good metaphor. If anybody has been a normal size and gained weight, or had a lot of weight on them and then lost weight, or had a baby, anything where you go from one size to the other very quickly, you get stretch marks, right? So it's like that, only in the liver. So once you have the stretch marks, right, you can do whatever you want. You can tan, you can tone, you can put on whatever lotions people are claiming this week help with stretch marks. But in the end, we all know, even if you lose weight and maintain it, and you have a healthy relationship with sunlight and tanning, you're always going to be able to see those stretch marks, even when they fade into those little white ones. So it's a similar idea. You know, if I have, because of my weight issues, of course I have stretch marks from back in the day, but because of the increase in fluid retention, I have new bright pink stretch marks that I've never had. My already expanded skin, my expanded body can't even keep up with it based on the weight I had lost before and the room my skin had, because my stretch marks had given that room, to where I even have to have new sets of stretch marks. So that's the same idea in the liver with cirrhosis. The only parts that can really regenerate are the ones that are barely nodule or just have fibrosis and not cirrhosis. My studies and labs and symptoms all indicate that I have more cirrhotic tissue than healthy or just fibrotic tissue. So I have a stacked deck against a healthcare system that either has not had any real training on the severity of these conditions, or they are specialized in it to the point where they don't give a crap what you say or what you try and relay as your experience, your outcome, your fears, your understandings. I mean, it's just, I'm bewildered by it, to be honest. I don't understand what the problem is, you know. Obviously, I'm a chronic pain, chronic disease, progressive illness patient, so I'm gonna be someone on someone's radar where they get paid for the rest of my life, because I will always have to have this kind of care. And with that, you'd think that a doctor would be more interested in building that relationship so we have a trust relationship, and I can believe that doctor when they say, if there were a different option, I would give it to you, but there's not. Instead, I'm just made fun of and made to feel like an idiot because they're not doing what everybody online, I don't mean like Bob's autoimmunehepatitis.com. I'm talking National Institute of Health, National Institute of Mental Health, all these places that are peer-reviewed scholarly articles. I'm supposed to have an ultrasound every 6 months to check on the status of my liver, of the blood flow, of the portal vein. They should be able to gauge those things, and it should be monitored. I should have my spleen monitored because it's enlarged, and without any comparison, how do you know how big it is versus how big it was? If you're not willing to even do the test, how would you know? This is the kind of crap I'm dealing with these doctors. And I understand that I'm annoying because I speak medical terminology, and I do challenge and I do ask questions because it's my right. It's my right to ask questions about the treatment for my body, and to be made to feel like I don't have any right to that because some doctor thinks he knows best about what my body needs without even listening to what I'm saying. It just, full credit to Family Guy. It really grinds my gears. You know what really grinds my gears? I love Family Guy. All credit to that show. I wasn't trying to steal anything. But this has been my last 24-ish hours, 36 hours, whatever it is. And it's just ridiculous. And the only medication I was given is like, okay, I know you have this gunshot wound, so I'm giving you this little Hello Kitty Band-Aid that'll fall off in about an hour, especially with any kind of sweating. So you just go home, and if it starts to bleed, then we don't really care because it's not as bad as you think it is. People get shot all the time. Why do you think that you're different? Why do you think that you're special because you got shot? There's plenty of people that get shot. That's the kind of attitude that I'm given. Whether it's because I'm off-putting because of my weight, people don't want to listen to me as much. You talk about discrimination in the healthcare system. I know that people of color and lower socioeconomic statuses get the crappiest end of the stick when it comes to medical discrimination. And I think the next in line, unfortunately, would be whatever color you are, whatever race you identify with, whatever gender you identify with. The next thing there is weight, fat shaming. I have been undiagnosed with a disease that I have probably had since I was 19 years old because of the progression and the symptoms that have occurred. It's a wonder that I didn't end up in a worse situation because of how long it went untreated or even discussed. This has probably been brewing since I was about 19 or 20. I just turned 40 this year. 20 years of people saying, you're just fat, lose weight. You have a non-alcoholic fatty liver disease. Just lose weight. Just lose weight. Wah, 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 wah. They don't want to hear about why it's difficult for me to lose weight. They don't want to hear that I've done research and tried 5 different ways from Sunday to try and get something to work for me. Supplements, actual medications, one doctor after the next. And it's like, instead of wanting people to have that autonomy, to be your own advocate, to work in concert with your provider, being able to trust their recommendation because you're also listened to with your concern and explained why I understand this is scary for you, or I understand why this would give you hesitation, but at the same time, this is why I think you need it. Outweigh the benefit and the risk. The only difference between what I'm expecting and what I've been given most of the time is doctors to act like human beings, to realize that there is a person at the other end of this stethoscope, at the other end of this IV, at the other end of this CT machine. There is a person in excruciating pain, through the roof anxiety, terrible headaches, bald, fat, scarred, prednisone zits everywhere. Seriously. I'm like that woman from that movie with that really vulgar comedian where it was a joke that after he slept with a woman, they would get married to the next guy they dated, and he was trying to test his powers by trying to set up a date with like the most outlandish depiction of gross. The woman was fat, the woman had like moles with hairs everywhere, food on her mouth, you know, chicken sticking out of her boobs and all that. I mean, it's the exaggerated version of it, but it is poignant when you talk about that and what it actually means with fat shaming, socioeconomic shaming, married to a woman shaming. I mean, the ways that I should be listened to versus the ways that I am pushed aside is just sad. It really is sad. So that's what I'm talking about today. I will do an update, and then maybe on Weight Loss Wednesday, or maybe just another random video, because I am seeing a primary tomorrow that is a functional medicine doctor, and I am trying to be optimistic that this person might listen to me, because functional medicine providers, do have a goal of treating the whole person, not just the symptoms. I mean, I know everybody makes money off of people more because of their chronic conditions being managed and constantly being seen to get managed, but the goal for most people really should be to only have to go to the doctor because something has actually happened. I broke my foot, I fell and hit my head, I have to be monitored for a concussion. That's the way it should go, not I woke up today and now I'm in the ER. That does not make sense. And yet that is what me and a lot of other people end up dealing with. So I'm gonna go ahead and cut this off. I'm not editing this. I am not doing anything extra to it. Because honestly, between how exhausted I am and the fact that it's no filter-free Natalie, I'm just giving it to you raw. I'm coming at you. So if you didn't like this, then it is your right to not like it. But if you don't like it because I'm fat or bald or freckled or diseased, then this is not the channel for you. It's just not. It's not the channel for you. Otherwise, thank you for the people who are listening, who are interested in following my progress. And now that I'm not being able to think what I'm going to say, that's a good indication my brain is going to stop supporting me now. So everybody have a great day, week, whenever I see you next. And remember to be your own advocate in every circumstance. Don't give up on being your own advocate because you keep being shoved down and squashed because you don't have any right to your own opinion. Be your own advocate. You're going to tick people off, but those people don't come home with you and deal with you on a daily basis. They have no comprehension of what your issues are, nor do they seem to care. So be your own advocate, fight for what you can, and be advised that when you do, if you have a doctor like I do, you're going to get made fun of blatantly with no, sorry, not sorry. I hope that you guys don't have to deal with that, but if you do, then you know. The joke with my dad, with certain physicians, I have a theory that usually the meaner a doctor is, the more that they're Dr. Asshole instead of Dr. Helpful. Usually that means they're really good at their job. Like, they're not good at peopling, but they're good at medicine. But that kind of gets a hitch in the plan there, because if you have a doctor who won't even look at the basic tests that you should have to monitor progress, then what good is it that they're also an asshole and maybe a good doctor? But I wouldn't know, because I'm not even interesting enough to be seen. I haven't been seen in the office for my hepatologist who's treating me since before the pandemic. It was January or February? January. Because all through February, I was not wanting to get everything done they wanted me to do, and again making fun of me. And then I finally did what they asked, and they were nice for a couple weeks, and then apparently asking questions or suggesting should I get this study or that makes me all of a sudden trying to be the doctor, which is just childish and petulant, and just speaks more to the fact that this doctor wants his shit to not stink. He wants to be considered the almighty hepatologist on high. And so I'm advocating for myself with other providers, with hopefully this new primary care, and I can't give up. If I give up being my own advocate, I'm basically signing my death sentence, because without me trying to do more, without the help of my parents and my wife trying to help me do more, I don't have much time left if I don't do this for myself, if I don't get that help. I will not be sentenced to death at 40 years old because a doctor gets his feelings hurt and his ego bruised at the idea that I have an idea what I want to do, whether he agrees or not. So end of soapbox there. If you have a doctor asshole in your care, as long as they make you feel heard, usually the mean doctor's bedside manner lacking is increased medical savvy. You know, like for those of you that watched Grey's Anatomy, Christina Yang would be considered, you know, not her, she's the mean one. She's known for being the mean one, but she's also a wonderful diagnostician and super into growing, and she learns more about how to be a normal doctor with people. But then there's the people that are really good at peopling, but maybe, you know, didn't have the best results in medical school. It doesn't matter. I'm just yammering at this point because why not? But again, thank you for another 5 minutes of paying attention to me. And I will update the next time I have something to update. How about that? Cash me outside. How about that? See you guys later.